everyone, this is Veronica and today we are going to discuss about generic only model. So as you can see in the picture, this is about the drugs, about the medicine, what is generic model and why we are talking about this model, what are the concerns that we'll discuss today in this lecture. So for my video updates, you can follow me on Instagram and the PDF of this lecture will be uploaded on my Facebook profile and the Telegram channel. So guys, if you're preparing for any government exam, our pen drive and Android courses are also available. For additional information, you can contact these numbers given on screen or you can visit our website, and till 25th of December we are giving flat 60% off on these courses also. So guys, let's talk what is the issue, because recently our Prime Minister is pushing towards generic drugs. So there's an increased push by the government because generic drugs are affordable for healthcare. But the concerns with the quality of the generics call for a relook on the generic only model, that we cannot compromise with the quality. What are the concerns related to it, we'll discuss. So first, before going deep into this topic, we'll discuss what are generic drugs. So see, the generic drug is basically a copy of drug medication that is created to be the same as an already marketed brand name drug. Now it equals in dosage form, in safety, strength, route of administration, quality, performance, characteristics and its intended use. But generics do not involve repetition of extensive clinical trials over the years, unlike the brands. That is why the brands are very costly, because they spend a lot on research and development of the drugs. So they go an extensive R&D procedure and they want to recover their cost once their brand drug is patented. Hence, generics manufacturing is less because they don't do any kind of research and development. They just copy the procedure, and so their prices are very low. So just let me give you an example. When paracetamol is sold under a brand named, for example, Calpol or Crocin, it is called a branded generic drug. But that is not a branded drug, it is still a branded generic drug, because in Indian context generic drugs mean something different and in Western context it means something else. Let me give you an example, because only names of drugs so that patients can access cheaper version of branded drugs. That is why government is focusing towards it. But in West, what happens? Branded drugs are the drugs where research and development takes place. But in India, generic drugs somewhere, they compromise with the quality of drugs. But in West, it is just about the price. Branded and generic drugs in West, it is the matter of difference between two is about price. But in India, quality is also an issue. That is why we call the generic drugs of West and India, they differ a lot. So here we are giving an example of branded generic drugs in case of India, right? Now, what is the emphasis on generics? Basically, the government, to cut down on out-of-pocket expenditure and ensure that affordable healthcare should be given to everyone, it is relying on its generic only model. And about Indian market, generics hold a great share in the market, that is around 75%. Now, the push for generics witnessed a boom under a particular this scheme of Government of India, that is Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana. It is a campaign which is launched by Department of Pharmaceuticals, to provide quality medicines at affordable prices to the masses. Now this PMBJP, that is Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, its stores have been set up to provide generic drugs which are sold to the people at very lesser prices. Okay, now we'll talk about the ranks, that if we are using if we are using generic only model, what are the problems we are going to face? See, India ranks third in global pharma market, that is 10% in global sales, but in domestic scenario the scene is very less encouraging. We are not doing much in the pharma sector. So there is a study published in 2016 on spurious and not of standard quality. NSQ means not of standard quality medicines in the supply chain. There was a study and it hinted a lot on Indian scenario. What they said, this study, that more than 10% samples were declared NSQ, that is not of standard quality, in supply chain in India of medicines which were procured by government agencies, whereas the scenario of all over India was 4%. So you can compare that the drugs that are being sold by government agencies, they are not of standard quality, and the percentage is 10%, whereas this percentage on all India level is quite less, that is 4%. Now Central Drug Standard Control Organization, that is CDSCO, its report shows that a range of commonly consumed generic drugs fall short of standard quality control criteria. In 2017, there were many drugs which were recalled from Jan Aushadhi stores over quality lapses, that they were not in strength, in quality, they were not so good, so they were recalled, right? So another 6 drugs were rolled back in the first 4 months of 2018. So this is a very bad scenario. So most of India's generic drug manufacturers do not follow US Food and Drug Administration guidelines, which should be followed for domestic distribution. And India has more than 67,000 drug formulations, but the quality control mechanism of all the central drugs testing laboratories can ascertain only around 15,753 drugs annually. So you can see there is shortage of regulatory and inspection mechanisms in our country. Now if we talk about branded generics, these branded generics follow regulatory mechanisms like US FDA and WHO. So that is what I was telling you. In India we have in West, so we will just compare what is in West and what is in India. West, there is a branded drug who do all the research and development, and they get patent, and these medicines are very expensive because they have spent a lot of money. Then in West there is generic drugs, which I told you, which copy the formula once the patent is expired. Okay, this is the scene in West. But what is in India? We rarely have branded drugs. Instead, we have branded generic drugs. Okay, like lot of good companies say like Cipla, Sun, Dr. Reddy, then there is Zydus, Cadila, okay, and then there are generic drugs, okay, which are not associated with any brand. So these drugs are mostly sold in India. There's large market, around 75% of these drugs, and they are made by unknown companies which do not meet the qualities set by US and Drug Administration. Only these branded generic drugs in India meet the quality control mechanism in India. So somewhere we are compromising with the quality of drugs. I hope this is clear to you that this is the biggest concern in India. Okay. So let's talk about what is the risk. So in 2020, it is estimated that non-communicable diseases burden will be responsible for 73% of deaths and 60% of disease burden in India. And low quality drug delay recovery time, it weakens. What it does, it weakens our immune system by a longer duration of doses and invites many problems. Because what happens if you are giving a standard drug to a patient, he will recover fast in just few days. But when you are giving a low quality generic drug, what will happen? You will give long dosage to him, he will recover, but the long term effects of such drugs are not good. And then when we talk about substandard medicines, they may promise affordable healthcare in the present, but in the future results could be catastrophic for the health system in our country with the health of the people. Thus, relying on generics alone can be counterproductive in the mission to make India disease free, right? So these are the risks which are associated with generic only model. Now what is the way forward? See, medicine procurement and distribution should be driven by global best standards, not only the lowest price, because we should not compromise with the health of our people. For the goal of universal health coverage by making medication affordable, superior quality of drugs are a prerequisite. They are required. And the generics only model approach needs a critical assessment for dealing with India's disease burden. We need to look at this model again and again, and we need to assure that the concerns which we just talked about should be clarified, they should be met, and the quality control of drugs should take place in our country. Even if you have any way forward, you can write in the comment box. So thank you. And for the PDF of this lecture, it will be uploaded on the Telegram channel also. Thanks.